Hello and welcome back to the Confidence and Beauty Summit, real root cause resolutions that reverse women's hair loss naturally. I am your host, Thrill Vasquez, a multi-certified functional medicine practitioner that is literally obsessed with reversing hair loss naturally. And as the CEO and founder of Volcanics, we bring you this summit to share a vision of a world where hopeless hair loss is a thing of the past and every woman has the opportunity to break through her limiting beliefs while embodying a new truth that will set her free. And that truth is hair loss is reversible. And today I have the lovely Dr. Kasey Holland. Look how beautiful she is. So we know she's doing something right. Hi, Kasey. Kasey, sorry.
Hi, Surreal. It's great to see you.
Yeah, so Dr. Kasey is a licensed naturopathic doctor in Montana. She sees patients currently at her clinic location in Big Fork, and she's also licensed in naturopathy in Alaska and California and offers telehealth services in all three states. She is an active member of the Montana Association of Naturopathic Physicians and the National Association of Environmental Medicine. In her free time, she enjoys playing volleyball, hiking to alpine lakes, and traveling with her husband and dogs, Ranger and Glacier. So happy to have you here today.
Great to be here.
Before we even get started with the conversation at hand, as far as Epstein-Barr virus and hair loss and thinning, and I will say I did have Kasha Kynes on here, and she did touch on that somewhat, but it's so interesting
Yeah.
to get multiple perspectives and talk to multiple practitioners. With that being said, before we jump into that, can you tell me a little bit about what got you into naturopathic medicine?
Yeah, I actually had kind of a lot of health problems as a child, mainly gastrointestinal and hormonal problems. And my naturopath really helped me. And I just loved the approach of getting to the root cause of what was causing my problems. Conventional medicine actually wanted to do exploratory surgery on me. And
Wow.
thankfully, my mom, said no and took me to see a naturopathic doctor. But basically, from the time I was 18 on, I pursued this track. And then while I was in school, I actually had Epstein-Barr virus reactivate. And so that's kind of what led me to specialize in complex illness and infections.
I love how everybody has their own unique story as far as what got them here. And I feel like there's always a path, right? But it's for greater good because a lot of people are able to benefit from our pain.
Yeah,
So
definitely.
speaking about this reactivation of Epstein-Barr virus, how did that present? Did you get hair loss and thinning from that? Or when you do see that in private practice, how is that presenting? Like what is the Epstein-Barr virus doing that is causing that?
Yeah, it's funny because I was thinking about this and I was like, did I have hair loss? And then I was like, well, I remember I always had kind of like I never liked my hairline. It wasn't full and it would kind of recede here. And I was like, oh, that was probably all all related. And yes, I do see women that have EBV reactivation or what I like to call complex illness, which is typically, maybe they've been exposed to mold, maybe they have some ANA markers, but they don't quite have an autoimmune condition. Maybe they have thyroid, but they have all these symptoms and it's hard to pin down. And I do commonly see thinning of hair, hair loss, um, and I see a lot of low hormones. And the what Epstein-Barr virus does is there's a couple ways to look at it. So it is associated with a lot of autoimmune conditions, and there are autoimmune conditions that cause hair loss. And when it's active, I like to tell people it's like pouring gasoline on a fire. You have all this inflammation, the virus turns on, and then the inflammation is even bigger. And we have this cellular dysregulation where your cells are not operating the way that they should be. So that's happening. But then I also see most patients that have Epstein-Barr virus reactivation have high levels of oxidative stress. Oxidative stress is literally like we're exposed to it daily. It's what ages us. It's if you think of a nail when it gets rusty, that's oxidative stress. The scientific version of that is reactive oxygenation species that our body is trying to clear out. Um, and our body isn't able to keep up with it. Our antioxidant levels aren't high enough, or there's just too much. So it's kind of like this fast forward of aging, and that can result in low hormones. I've seen women in their 20s and 30s, and their hormones look like that of somebody menopausal, and then they have hair loss. And then the oxidative stress in and of itself can cause hair loss. And then if they do have an autoimmune condition, um, like I mean, all of them can be associated with hair loss. And then, of course, there's the ones that are more where we actually have clumps of hair coming out, and it's the autoimmune condition is actually associated with that region. And then we can see even more severe hair loss.
So, in someone who does have Epstein-Barr virus reactivation, uh, would the answer there be to just introduce some superfoods? I'm sure it's so much more complicated than that, but would
Mhm.
that assist in helping to bring down that level of oxidative stress?
It can help. Um, in patients that I see with EBV reactivation, a lot of times I see them do these really intense diets and protocols. And sometimes I think that helps. It's a foundation, definitely, especially when we're looking at the body holistically and its important piece. But sometimes that's not enough to actually get them into remission and improve. But definitely, nutritious, high antioxidant diet is really important, especially, when we're trying to grow our hair back.
Yes, absolutely. And so, how does someone test for Epstein-Barr virus? Is it just you go to any doctor and you're like, "Hey, test screen me for Epstein-Barr." Is there some sort of special way to test for it?
Yeah, it's a blood draw. The panel is a little bit unique. A lot of times, conventional doctors don't know how to test for reactivation. They'll just do a basic monospot, which Epstein-Barr virus causes mono. So that's how most of us think of it, as the kissing disease that you get when you're in grade school or high school, some people college. And that is just a single test. They test viral capsid antigen IgM. And that is only for the first time that you get it. And most people are dealing with a reactivation. So they need to run a complete panel, which also has the IgGs and the early antigen. And so your conventional doctor can run this. You just want to make sure that they are, I guess, EBV literate, which is becoming more common now. But sometimes all they know about is the monospot.
Okay, so what does the reactivation of Epstein-Barr virus look like? How does someone know, wait, I might have an issue with this? And I did have a question about lymph because is there a way for you to reactivate Epstein-Barr virus by moving your lymph? Because I thought I heard something like that, but you can correct me if I'm wrong. Like if you move your lymph the wrong way, then you can reactivate the disease or something like that. So let's talk about first what does that present like, and then let's also talk about like are there different ways to activate lymph drainage that are more conscious of that if that's a thing.
Yeah, so typically patients have kind of flu-like symptoms. They might have a sore throat, they might be achy. Sometimes it presents cyclically with women's menstrual cycles. They might feel like that feeling that you're about to get sick, like you kind of have a sore throat, low-grade fever, but you're not sick. And then usually people have a lot of fatigue. There are other symptoms too. Some people are really anxious. And because EBV is associated with so many different conditions, you can have other symptoms with it. The fatigue is, the main symptom that patients present with. And then some people will say, I have hair loss, I have this, I have that. As far as lymph, I think is what is probably being said here is that when you move lymph, your body is trying to remove toxins and things like that. And so if you go to move it, but then your body can't clear it out, there could be toxins that are then re-released, sort of. And that could trigger a flare-up in the viral load.
So what would be the correct way to handle that? Just to make sure that the liver is being supported in all the phases of detoxification, or maybe doing more sauna use, or drinking more fluids, or dry brushing? What would be the correct way to handle that possibility?
Yeah, the first thing would be to make sure that you're having regular bowel movements, so that you're not constipated, that you are moving. Lymph, it doesn't move unless we move. So if it's and it's really hard when you're fatigued, right? Like you don't want to go and exercise, but even just gentle walking, if you can. If you are bedbound, some people are at the point where they're not walking or whatnot, then having somebody help you lifting your limbs, moving, manual massage, but make sure that you're moving. Definitely hydration, liver support, and then also drainage support. So sometimes the cells go into a cell danger response when patients are really sick and they don't release toxins properly. And if that's happening, then you might need to, red light therapy can be helpful with that. Different homeopathic remedies, different antioxidants can also help with that, but we want to make sure that the drainage portion is happening as well.
Amazing. Okay, thank you for all of that information. Let's talk about hair loss a little bit more when it comes to Epstein-Barr virus. Are we thinking, okay, Epstein-Barr virus is this chronic exposure to, would we call it inflammation, so to speak, because of the pathology of it? And then is that going to induce alopecia areata, or is it all kinds of hair loss? Or how does that necessarily express when you have that reactivation of Epstein-Barr virus coinciding with hair loss?
Yeah. So I always get asked, like, does EBV actually cause cancer? Does it actually cause autoimmune conditions? And in those conditions, it's very common to see EBV reactivated, but I've never seen a patient where the only problem that they had was EBV. There were always other things, heavy metals, mold, high stress, adrenal issues, thyroid. So it depends on, what else is going on in the body, because one person can have EBV reactivation and they will have a totally different treatment plan than somebody else. And honestly, like I've seen hundreds, probably thousands of patients, and everybody gets a different treatment plan. It's not a cookie cutter. So we have to look at things individually. So with hair loss, sometimes they have Hashimoto's. It's very common that we have Hashimoto's with Epstein-Barr virus and thyroid issues, and thyroid issues are already associated with hair loss, and that hair loss is more kind of generalized, right? When we get to the acroleal areata, where we have clumps coming out in an actual autoimmune condition, that's pretty severe hair loss. And when we're at that point where we have an autoimmune condition, we have to treat the EBV, we have to decrease the inflammation and kind of combat those pathways that are dysregulated in the autoimmune condition. And then we also have to look at, why are we here? Was there a mold illness? Was there exposure to pesticides? Was there really high stress? Is this post-COVID? And we have to deal with all of that too in order to get things under control and get your hair growing back.
So it's not so much like Epstein-Barr virus actually attacks the follicle in and of itself. It's just that it makes you more compromised, and then that state of being is more susceptible to things like mold illness, and then Hashimoto's and leaky gut and some of these other things, because Epstein-Barr virus is kind of hijacking your immune system, so to speak. Because what
Yeah.
exactly does Epstein-Barr virus do? It just like it's a virus that does what?
Yeah, so it's an opportunistic infection that goes from an inactive state to an active state. So when it's replicating is when it causes problems. So our body is supposed to be able to deal with it. I did look through the research and it seems, so there are cases where, somebody had SIBO and they had EBV and the EBV was found in the gastrointestinal tissue. It does look like it's possible that the EBV may be more localized to whichever area, which in this case, hair loss. And it's possible that that has a more direct link. We just don't have a lot of studies on that yet. So I can't say like, yes, it turns on this switch and then this does this to the hair follicles. So in general, it's doing all these things. And then how specific it is to that specific tissue, I can't say specifically, but it is possible that depending on where we have the problem like Hashimoto's versus, lupus or something, that the virus is localized somewhere differently.
Okay. All right. But essentially, whether it's localized or not, overall, we're just looking at supporting the body's ability to stop it from replicating Epstein-Barr virus. And we do that by reinforcing the immune system and reducing the toxic burden. Is that correct?
Yes, absolutely.
Okay. All right. Well, that's amazing. I know that our time is short today and you have to leave soon. Before you do that, maybe just share with our listeners where they can find more of you. And then I'm going to ask you my closing question that I ask everyone.
Okay. Yeah, you can find me at drkaseyholland.com. I'm also on Instagram, Facebook, LinkedIn, X, and YouTube. It's just all just Dr. Kasey Holland. Yeah.
Okay, great. Okay, so here's my closing question if you're ready for me.
Okay.
There's a woman who's watching this who's either already wearing wigs or she's about to start shopping for them. But at the very least, she just feels devastated about her hair loss and thinning. And she's starting to think, maybe I just need to work on acceptance because she's tired emotionally from having hope and then getting disappointed. And so, can you speak to that woman to be able to speak life and hope into her to encourage her to keep going? And you can do that either by doing that or sharing a story of a moment in your life where you were faced with a challenge that seemed literally impossible and you had no idea how in the world we were going to get through it, but somehow you made the impossible happen and you found the way. And so by sharing that story, you can give some hope to this woman that, listen, just focus on like why you need to make this happen and then the results will come because you know results come after reasons.
Yeah, my first year out as a physician, I was in residency and I was really sick. And I thought, that's when I found out, like, oh, this is EBV. And I was supposed to be seeing patients, I was supposed to be doing all this, and I felt awful. I mean, it was hard to get out of bed. It turned out that I was also exposed to mold, and so I really had to shift my mindset and believe that my body was not working against me, that it wanted to heal and that it was talking to me. And once I did that, that led to me moving out, getting a mold-free home, and really diving into what my body needed. Enough protein in my diet, prioritizing self-care, decreasing stress, prioritizing time where I was moving and exercising. And I think in our society, it's so hard to do some of those things because we're busy, we want to get this and we want to get that done, or there's you can feel very disempowered, like your body is failing you. This is how you are. This is your diagnosis. You're going to be on these medications for life. You can't overcome this. And so I tell people to take two fingers and feel their pulse and feel it. Your body does that all day, every day, keeps you alive. Your body knows what it's doing and it wants to heal. We just have to give it the tools that it needs.
So beautifully said. Thank you so much, Dr. Kasey, for coming on and pouring into everyone's life and to everyone who's watching. We want to encourage you to really take those words to heart and to continue to listen to speakers such as Dr. Kasey and everyone else here on the summit. So we hope to see you again. And thank you again, Dr. Kasey, for making time to pour into everyone today.
Thanks for having me, Surreal.
Bye-bye.